Hello everyone, I'm Reiki Master Lucy Jin. I started my Reiki journey back in 2020 and now serve as a full-time Reiki Master and practitioner, as well as the president of the Korea Reiki Association. I am also the first licensed teacher in Korea from the International Center of Reiki Training. Today, for those who are encountering Reiki for the first time, I will explain what Reiki is, its healing principles, the healing effects proven by research papers, case studies of its use in hospitals, and testimonials from people who have experienced Reiki. So, what exactly is Reiki? Reiki is a healing therapy started in 1922 by Japanese-born Mikao Usui, which uses the hands to transmit energy to reduce stress and promote relaxation and healing of the body and mind. It is primarily done by laying on of hands, and anyone can easily learn to perform Reiki healing. Reiki is a natural healing method that is non-invasive, has no side effects, and is safe. Reiki refers to life energy imbued with spiritual wisdom. All living things have a life energy or ki flowing within and around them. This is our vital energy. When a person is influenced by stress, negative emotions, or thoughts, their vital energy may weaken, and if this balance is disturbed, physical symptoms or illnesses can indeed begin to manifest. This is all about energy medicine and about holistic practices in general. A definitive scientific explanation for how Reiki functions has not yet been fully uncovered or elucidated. The most compelling theory we have to date is Oshman's theory. This theory suggests that the flow of Reiki from a practitioner's body is triggered by environmental factors, such as the Schumann resonance, which then influences and amplifies brainwaves, promoting healing. The Schumann resonance is an electromagnetic phenomenon generated by lightning pulses between the ionosphere and the Earth's surface. The Schumann resonance has an extremely low frequency of 7.8 Hz, which matches the brainwave frequency associated with meditative states, but it's thousands of times stronger than the electromagnetic field generated by brainwaves. Practitioners detect these regular pulsations of Earth's magnetic field in the brain's pineal gland. When practitioners consciously or unconsciously align their breathing with the Schumann frequency, their body's biofield synchronizes with their brainwaves. Then, the brainwaves of the person being healed synchronize with the practitioner's biofield. At this point, an extremely low-frequency healing energy is emitted from the practitioner's hands, affecting the recipient's biochemistry and cellular physiology. For example, there are studies indicating that a 7 Hz frequency can stimulate bone growth, and 10 Hz may promote ligament healing. This is similar to the principle of resonance. Just as two instruments playing closely together influence each other's vibrations, when a practitioner is in a state of meditation and relaxation, the person receiving healing resonates with that frequency. Reiki is a complementary therapy that supplements, not replaces, hospital treatments. Reiki proves beneficial in alleviating pain, muscle tension, insomnia, fatigue, anxiety, and depression associated with illness. Reiki transforms the nervous system. Scientific studies have shown that Reiki reduces the activity of the sympathetic nervous system's fight or flight response and shifts it to the parasympathetic nervous system's rest and recover mode. The parasympathetic state is essential for healing because it allows the body's natural recovery and regeneration processes to function optimally. Reiki reduces stress. The soothing effect of Reiki energy calms the nervous system, which helps to diminish the production of stress hormones such as cortisol. It decreases blood pressure and alleviates depression. Reiki positively enhances your overall mood. According to research by Erdogan and Sinar, many participants reported feeling relaxed, happy, and safe during Reiki sessions, and also noted an improvement in their coping abilities. Some even showed remarkable recovery from coexisting ailments. One elderly man, diagnosed with Parkinson's disease and who described frequent falls, said he used to fall 4 or 5 times a day before starting Reiki, and expressed his feelings at the end of the 7th week as follows. He mentioned that his falls were now down to just once or twice a week, and he expressed feeling much happier, crying less often, and truly loving life. Reiki is known to promote physical healing. The body has an inherent natural healing ability, but this ability is not activated when in a state of chronic stress or in the sympathetic nervous system's fight or flight response. Reiki encourages the body's natural healing abilities by fostering relaxation. According to a 2013 study by Baldwin, when Reiki was performed on people with reduced range of motion due to shoulder injuries, their range of motion increased. While physical therapy increased the range of motion by 12 degrees, Reiki increased it by 20 degrees. When patients who had knee surgery received Reiki, their post-operative pain levels significantly decreased. Systolic, diastolic blood pressure, and anxiety all decreased. Reiki can also improve sleep quality. Studies show that people with poor sleep habits may be at a higher risk for cardiovascular disease. Improving the quality and quantity of sleep allows the body to rest and provides the energy needed to heal damaged tissues. Reiki has been shown to improve sleep quality and enhance the quality of life for epilepsy patients. It is also effective in treating cancer patients. While Reiki itself, as a complementary therapy, cannot cure cancer, it does reduce the unpleasant side effects of chemotherapy, such as weakness and nausea, and alleviates pain, anxiety, and fear. Due to these benefits, Reiki is now offered for patient care in many hospitals overseas. It is one of the top 3 complementary therapies offered in U.S. hospitals. According to a study published in USA Today, by 2007, over 60 U.S. hospitals were providing Reiki as a hospital service, and 800 hospitals had implemented Reiki education. According to research by the International Association of Reiki Professionals, 60% of the top 25 U.S. hospitals, as selected by U.S. News and World Report in 2002, were implementing Reiki programs. Portsmouth Regional Hospital, located in New Hampshire, has been operating and offering a Reiki program since 1997. Reiki volunteers dedicate their time at the hospital throughout the week, offering Reiki sessions to patients who request it on the morning of their surgery and an additional 15 to 20-minute session before they are transferred to the operating room. The Reiki program at Brigham and Women's Hospital is staffed by over 60 volunteer Reiki practitioners and certified nurses and other staff members who are also Reiki practitioners. Over the past 8 years, they have provided more than 40,000 Reiki sessions to patients, families, and hospital staff. Based on feedback from patients, families, and staff who received Reiki sessions, as well as external research, data shows that Reiki promotes relaxation, reduces stress and anxiety, alleviates pain and fatigue, and improves overall quality of life. California Pacific Medical Center stands as one of the largest medical facilities in the northern region of California. Its health and healing clinic offers treatments for acute and chronic illnesses using a variety of complementary therapies, including Reiki. Dr. Mike Cantwell, an infectious disease pediatrician, is also a Reiki master. He states, "I have found Reiki to be useful in treating acute conditions such as musculoskeletal injuries, pain, headaches, acute infections, and asthma. Reiki is also useful for patients with chronic illnesses, especially those associated with chronic pain." Hartford Hospital in Connecticut provided 58,214 Reiki sessions over 15 years, starting in 1998. 570 patients who underwent Reiki treatments from December 1999 to December 2000 reported experiencing substantially less pain and increased comfort following their Reiki sessions. Of the patients who received Reiki between July and December 2004, 97% reported improved sleep and 91% reported reduced nausea. Here is an interview with a patient from Hartford Hospital. "Because of the profound impact Reiki had on me, I will never choose to go to another hospital again. I've undergone 8 surgeries, and the final one at Hartford Hospital was by far the most agonizing experience. The Reiki sessions truly helped me cope with that intense pain, and I firmly believe that with Reiki I can overcome it once more." Here is an interview from another patient. "Even after taking painkillers, the pain wouldn't go away, but after receiving a Reiki session, it was the only time I couldn't feel the pain. Since 2020, I have had the privilege of providing Reiki sessions to numerous clients and teaching Reiki classes to a great many students. Let me share testimonials from those who've experienced Reiki's healing via sessions and classes. After learning Reiki, my knee and back pain greatly eased. Initially, it worsened, perhaps a healing crisis. With that pain gone, I could walk or sit without pain, improving my quality of life. Injured during exercise, I had surgery for a torn meniscus last fall. I experienced pain in my knee and leg, which caused an imbalance in my posture and led to back pain. I'm so glad to be recovered. It's the first time since last September I've been able to walk and stand for over an hour. My 43-year-old sister, too young for menopause, hadn't had a period in 6 months. Her cycle was irregular for 2 years. My sister expressed profound gratitude, saying that her menstrual cycle returned to normal the day after I performed Reiki on her. After the first session, I grasped what it means to be healed by Reiki. Relationships brought more opportunities, and I enjoyed time with people. As a service worker, client interactions became easier, improving my performance and recognition. January and February brought many wonderful things. After 3 sessions, I could assert myself more confidently and even show anger. There was a time when I had to work with strangers, and I was surprised that I did well without taking my anxiety medication. I still get anxious, but my resistance to it has lessened a lot. During Reiki, my legs and feet sometimes twitched, and over time, my body grew warmer. My head also felt much clearer and lighter. The tension-related jaw muscle pain had been going on for about 1 or 2 weeks when I had my first session, but I felt the tension slowly release and the pain almost disappear while receiving Reiki. Reiki is a spiritual life energy with its own wisdom, and it can become a lifestyle that heals and guides your entire life, going beyond a simple healing therapy. Reiki has the amazing potential to resolve many of life's discomforts, allowing your whole life to flow smoothly and seamlessly. Reiki can elevate an individual's and thus humanity's consciousness. Because it doesn't necessitate doctrines or beliefs like a religion, individuals of any faith can utilize it as a means to practice their beliefs, and those without a religion can also freely use it as a spiritual practice. Many, myself included, share that their lives have positively transformed since encountering Reiki, truly considering it one of life's significant blessings and gifts. If you are feeling an inner pull or calling right now, it means that Reiki has found you. I encourage you to directly experience Reiki, learn to practice it, and become a Reiki practitioner so you can heal yourself, your loved ones, and the world.